What's up, guys? It's Dr. Jim. I am your CBD expert, your natural healthcare expert, and your worldwide virtual health coach. And I want to welcome you to tonight's live. Now, tonight's title is CBD oil and the symptoms of a low thyroid, right? Is anybody excited about that, right? Who doesn't want to know about that? That is a hot topic. People are questioning me about it all the time. So when you're getting on tonight, please go ahead and if you'll put in whether you're watching, where you're coming in from and whether you're watching it live, because I gotta know, are you getting the full energy of Dr. Jim live? Are you watching it on the replay? But either way, it's gonna be awesome because you're here and I'm here and we've got a hot topic, and that's all that it really takes. It's gonna be amazing. So tonight's title is CBD oil and the symptoms of a low thyroid, right? Who here has a low thyroid? Send me a little hands up emoji if you've been diagnosed with a low thyroid. I'm sure it's a hot topic because I get questions about it every day in office, online. It is a hot topic. Now, tonight's disclaimer is CBD oil is not number one, it is CBD oil is a natural substance. It is not a drug. Therefore, it is not for the diagnosis or treatment or cure of any specific condition, including hypothyroidism or anything like that. So use this for informational purposes. Also, I am not your doctor tonight. You are not my patient tonight. There is nothing about this video that constitutes a doctor-patient relationship. So please do not change anything about your current medical treatment because you heard Dr. Jim talk about something cool on a video. All right? So, again, tonight's topic, thank you everybody for getting on. I'm loving seeing all these names, a lot of people on tonight. So, tonight's topic is CBD oil and the symptoms of a low thyroid. Well, if you have a low thyroid, you already know all these. I'm not going to give you any information you don't already know, but for people who maybe don't know or suspect that they may have a thyroid problem and have never actually been diagnosed, there's a whole bunch of symptoms that go along with it. Probably one of the main ones is fatigue, and I don't just mean a little tired. I mean crushing fatigue, all right? I heard a story of one of my patients talk about pulling up to a stoplight. They stopped at the red light, and they fell asleep within seconds of stopping at the red light. I'm talking crushing fatigue, weakness, weight gain. And I'm not just talking over the last 10 years I've gained 5 pounds. I'm talking about I gained 10 pounds last month, and everything I do to try to get rid of it, I can't get rid of it. I've cut my calories, I started doing this, and I keep gaining weight, and nothing will help me lose weight, all right? Coarse and dry hair, a loss of hair, all right? Hair is coming out, some of it's always coming out, but I'm talking really coming out, all right? Cold all the time, can't seem to get warm. Definitely intolerance to cold. That's a really big symptom of a low thyroid. Constipation, depression, brain fog, gallbladder problems. And another one, in really advanced things, you can see that the outer third of the eyebrows starts to disappear. All right, these are all signs and symptoms of a low thyroid. Now, a lot of people ask me, Doc, well, how could a low thyroid have an impact in so many different areas, right? Gosh, I look like I'm 1977. I don't know what happened to my lighting, but I got yellow all of a sudden. Ugh. How do I get not yellow? What happened? I don't know. Anyway, I'm sorry that I look yellow on the screen. I'm going to try to change this so I don't look so bad. I'm all blown out. All right, anyway, there we go. The point about a low thyroid and how does it impact so many different places? Well, it is because literally your thyroid hormones control your metabolism, how your body metabolizes everything, which impacts growth and cell division and everything. There are literally thyroid hormone receptors on almost, because I don't think they're not on red blood cells, but on almost every single cell in your body has a thyroid hormone receptor on it. That's how important your thyroid hormones are to how your body functions, how your metabolism works, okay? So that's why you can have all these nasty symptoms, and that's important. Now, how can CBD oil have an impact on these low thyroid symptoms? Well, let's start with what's the number one cause of a low thyroid. Well, this is going to shock a lot of people, but the number one cause of a low thyroid in the United States, bar none, is not even actually a problem with your thyroid gland. All right? It's actually an autoimmune condition that attacks your thyroid gland. All right? I want to make sure everyone understands the difference, because it's a big difference. All right? Because if it's a problem with just your thyroid, doesn't make enough thyroid hormones, if you take thyroid hormones, it will fix it. All right? But that's not the case. The number one cause of a low thyroid in the United States is actually an autoimmune condition that attacks and destroys your thyroid gland. And that makes it so that your thyroid doesn't, it breaks down over time. Now here's the problem, it's an autoimmune condition. So not only does it start attacking your thyroid gland, but it doesn't necessarily have to stop there. It can move on, it can attack many, many other places. And so here's the deal. This is a common story that I hear in my office. Like, doc, I started having all the, I was tired, I was cold, I started gaining weight, my hair started coming out, my skin was dry. All of this was happening and I just didn't know what was going on. So I went to my doctor and my doc's like, man, that sounds like you have a thyroid problem. And he runs a single test and it's called the TSH test, the thyroid stimulating hormone test. And he finds out that your thyroid stimulating hormone was high, which basically means you don't have enough thyroid hormones. Your body's trying to stimulate more thyroid, right? So the doc goes, oh, well, you have a thyroid problem. You have low thyroid. You go, oh, thank God, I knew there was something wrong. So he writes a prescription for thyroid hormones, says, here, take this, come back and see me in 3 months. You go back in 3 months, he runs a test again, and he's like, we got it, all right? Your TSH is normal, everything looks perfect. And then that's when you've got to be kidding me, doc, because you look at him and you go, wait a minute, how could this be true? Because I'm still tired, my hair's still coming out, I'm still gaining weight or can't lose weight, I'm still cold all the time, I still have all the same symptoms of low thyroid, and now you're telling me that my test looks normal and I don't have a low thyroid. Well, that is the common problem that we see, and it's because if your thyroid tests are normal, but yet you still have all the symptoms of a low thyroid problem, that's where CBD oil can have a really positive impact. Because at that point, it's not a thyroid problem. It's not a problem with the amount of thyroid hormones circulating in your bloodstream. It's number one, it could be the autoimmune condition, Hashimoto's. Because this is what happens. You have all the thyroid hormones you need floating around in your body, but if you have this autoimmune condition and it's not being addressed, then there are clouds of inflammation that blocking your thyroid receptor sites. So you have enough thyroid hormones, but because of the autoimmune condition, the thyroid hormones cannot attach to the thyroid receptor sites, and you therefore have a low expression of your thyroid hormones. Does that make sense to everybody? Do you get what I'm saying? I'm basically telling you that you can have plenty of thyroid hormones, but if you have this autoimmune condition and you have this cloud of inflammatory cytokines blocking your thyroid receptor sites, the thyroid hormones can't bind to the cells, therefore you can't have an expression of thyroid hormones. So you still have all the symptoms of a low thyroid, even though your thyroid numbers, your TSH test looks normal, all right? So how can CBD oil help with that? Well, I've talked about it in a lot of videos, but we know that CBD oil has a positive impact on your immune system, right? So in this autoimmune condition, your immune system gets out of balance, all right? You either have too many cells marking things to be attacked or too many cells out there killing things, and this imbalance is what allows your immune system to attack your own body, all right? It's what allows your immune system to attack your thyroid gland. Well, we know that CBD oil has an immune modulatory impact. What it does is it can help, gosh, I don't know why I keep looking yellow. It's driving me nuts. Maybe? Yeah? I don't know. Anyway, there we go. Back to not yellow. So basically what it does is it helps modulate the immune system. It helps bring balance to the immune system. And when you bring balance to the immune system, you help control autoimmune conditions. So if you can bring balance to the immune system, you no longer have so many inflammatory cytokines floating around in the bloodstream, and your thyroid hormones can actually attach to the receptor site. So guess what? You're now going to have a better expression of thyroid because of the CBD oil. And we also know that CBD oil helps just reduce inflammation, which is positive for an autoimmune condition. So if the number one cause of a low thyroid in the United States, bar none, is an autoimmune condition that's attacking your thyroid, and you've got put on thyroid hormones because you had a high TSH test, and they come back and they tell you it's normal, and you still don't feel well, it's because of these inflammatory cytokines blocking your thyroid receptor sites. And guess what? CBD oil is going to help with that. CBD oil is going to balance out your immune system some and reduce the inflammatory cytokines, so you should have a positive impact with that. All right, so that's number one. All right, it helps the autoimmune condition that's the number one cause of a low thyroid. All right, now number two, I'm going to keep moving this around until I don't look yellow, which I'm not going to figure out tonight. So I'm sorry everybody, I'm yellow. I don't know how to fix it. My lighting is garbage. I don't know. What? Oh, whoa. All right, well, now I'm dark. Anyway, number two, one of the super common reasons to have low thyroid symptoms, even though your numbers may be normal now, is a problem that's called underconversion. All right, so here's how it works. Your pituitary gland pumps out thyroid stimulating hormone, telling your thyroid you need to make thyroid hormones. Now, your thyroid makes T4, which is basically it's a thyroid hormone that is inactive. All right, it's not the active form of thyroid hormones. T4 then has to go down to your liver, and in your liver, T4 gets converted into T3. Now, T3 is the actual active form of thyroid hormones. So it's what attaches to receptors and makes everything positive, and that happens. All right. So thank you for telling me that that's better. So basically, what happens is T4 has to convert to T3 for T3 to be the active form of thyroid hormones. Well, guess what? If you don't convert T4 to T3, you have an underconversion of it. You can have a normal TSH and normal T4, but have low T3. You have all the symptoms of a low thyroid, but yet all your numbers over here look normal. Everything they're testing looks normal, but you don't have the T3 that your body needs to actually fire and function. All right? Well, here's the deal. What causes that underconversion? Because it goes to your liver first. Well, one of the main things that causes underconversion is an increase in cortisol. All right? Cortisol is a stress hormone produced by your adrenal glands, and what it does is increases in cortisol downregulate the 5-deiodinase enzyme that converts T4 to T3. So high stress hormones like cortisol cause you to not create as much, you don't turn as much T4 into T3. So you have an underconversion. So if you have this chronic stress pattern going on in your body and chronically high cortisol levels, chronic high stress hormones, then you are going to underconvert your T to T3. Now you don't have enough thyroid hormones. You have all these symptoms of a low thyroid. Get it? That's your underconversion problem. So guess what? Kind of cool stuff. Guess what CBD oil does? Well, CBD oil has been shown to help mute or modulate the stress hormone response. All right? CBD oil can help regulate, mute, modulate the cortisol response. So if your body has been pumping out stress hormones like crazy, CBD oil can help calm that out. All right? So you're not pumping out cortisol at the high levels you were before. Now you are not down-regulating the conversion of T4 to T3 the way you were before. And now guess what? You start making more T3. And T3 is the active form of thyroid hormones. And now all of a sudden, you start to feel like you're getting the thyroid hormones that you should have gotten the whole time. Isn't that awesome? That's what CBD oil does. It's awesome. Now, here's the second part. The majority of the conversion happens in your liver. But guess where it also happens? It happens in your gut. So if you have bad gut, if you have an inflamed gut, you're gonna underconvert there. Well, guess what? CBD oil has also been shown to reduce gut inflammation. And reducing gut inflammation is going to make sure that your conversion of T4 to T3 in the gut is also functioning at its optimal. So there is another way in which CBD oil is going to be very, very positive in helping take care of this underconversion problem. All right? Now, third and last one is, has anybody heard of reverse T3? Right? It's hot, man. People that are into thyroid problems know about reverse T3. But here's what happens. We already said thyroid makes T4. T4 goes to your liver. Well, here's what it does. In your liver is where it converts from T4 to T3. But the liver also converts some of that T4 to reverse T3. Now, reverse T3 is an inactive form of T3. Now, the reason your body does this is just like sometimes you can overproduce T4, and in the minute, your body doesn't need all that T3, so it converts some of it to reverse T3 so you don't have so much T3 going on, all right? All right, does that make sense? So, but guess what? More and more we're seeing is a problem where people have normal TSH, normal T4, and they go and then they don't have enough T3, but it's also because they have this significant increase in reverse T3. So why is the body, what is one of the main reasons that the body doesn't create the T3, the active form, but creates reverse T3, the inactive form? Because if you have really high reverse T3, guess what? You're going to have all the symptoms of a low thyroid, and all these other numbers are going to look normal. All right? So what happens is one of the main causes of an increase in reverse T3 is a significant increase in chronic inflammation. All right? So an increase in chronic inflammation will cause your body to create more reverse T3 and less T3. We want T3, remember? So we want less reverse T3, we want more T3, and we know that chronic inflammation causes that problem to happen. Well, guess what CBD oil does? We already talked about it, but we know that through CBD oil's interaction with CB2 receptors that are all on your immune system cells, by having that interaction, CBD oil can reduce inflammation, chronic inflammation. If you reduce chronic inflammation, you have a positive impact on the reverse T3 to T3 conversion, and if you can reduce reverse T3, you'll increase T3, and that's the active form of thyroid hormones, and that's what you want because that's going to drive your metabolism. That's going to help you with all of your symptoms of a low thyroid. So, just to recap really quick, how does CBD oil help with the symptoms of a low thyroid? Well, number one, listen, it is not a replacement for thyroid hormones. Basically meaning taking CBD oil is not going to make your thyroid make more thyroid hormones, all right? But if your thyroid has the capacity to make thyroid hormones, because number one, the number one cause of a low thyroid in the United States is an autoimmune condition, where your immune system's so out of balance it's attacking and destroying your thyroid gland. It's a really bad stuff, all right? And when it does that, it will create a huge problem, all right? So when it's attacking that thyroid, you can have all the normal thyroid hormones, but you may have all this excess inflammatory stuff blocking your thyroid receptors. CBD oil helps reduce and modulate the immune system, balance everything out so those thyroid hormones can get through and act the way that they want to. All right. Number two is an underconversion problem. And we know that one of the main causes of underconversion is high cortisol or stress hormones. And we know that CBD oil can help mute and modulate down the stress hormones so that you can convert T4 to the active form of T3. And then the third way that it helps is we know that when you convert T4 to T3, it also makes reverse T3. And we know that chronic inflammation will cause you to have an increase of reverse T3, an inactive form of T3 versus the active form of T3. And we know that CBD oil has a positive impact in reducing inflammation. Therefore, we're going to make less reverse T3, more T3, and that's going to help with all of your symptoms of a low thyroid. Now, you can imagine that if you have a thyroid problem and your numbers now all look normal, but you still have all the symptoms of a low thyroid, I cannot recommend taking CBD oil enough. Now, there's a lot of garbage out there, but if you want to know the CBD oil that I recommend, all right, what I want you to do, don't message me here, but I want you to direct message me on this page and say, Doc, what should I take? What brand do I recommend? All right, and I will send you exactly what I recommend. I will send you a link that you can order for me. Now, if someone else sent you this video, please get back with them, and I'm sure they probably know me, they probably know what I recommend, and they'll send you a link to what they recommend, which is probably what I recommend. But this is what I want you to know. If you want that information, please direct message me and I'll send you a link so that you can order what I recommend. Number two, if you would like to get involved, if you'd like to partner with me in this CBD oil business, please direct message me and say, I want to be on your team, because I am using all my knowledge, all my expertise to help the people on my team grow and help people all over the world. If you want to do that, then please definitely direct message me, say I want to be on your team, and we'll get together and I will help you launch and be very successful in this CBD oil business. All right? Now, this is really important, all right? Because I want everyone to know that I have some serious help for people that have thyroid problems or autoimmune conditions, chronic healthcare conditions, all right? This is big stuff. So I am in a collaboration with the world's foremost expert in autoimmune chronic healthcare conditions. They have treated over 15,000 cases with over an 85% success rate. And basically we have a test. Our collaboration, this is it, all right? Here's the kit. But with this test, all right, we can now basically reveal how to reverse or overcome your autoimmune condition, your thyroid condition, your diabetes in 90 days without drugs, without surgery, and without following crazy diets and taking a bunch of useless supplements that you don't know that you need, all right? This test tests at the cellular level where the malfunctions are in your metabolic processes, where the blockages are, and exactly what we need to do to fix it. What you need to eat and exactly what you need to take. With laser-like precision. It's specific to you as your fingerprint. Now this is what's cool. I've been doing this for a while now, and we sent out tests today. We're getting back tests in every day. And I have to tell you, the results are mind-blowing. All right, this is finding the very cause of what the problem is and exactly how to fix it. All right, so I want to help you fix it. All right, so if you are interested in this test, in the program that I am offering across the world, basically you have to be English speaking. That's it. All right, but if you want this test, if you want the program that in 90 days is reversing autoimmune conditions and your thyroid problems, then what I want you to do is just put test in the comments, all right? Just for more information. If you put test in the comments, check your messenger, because we're going to send you a little bit of information and a small video to watch in your messenger. And it's going to explain how the test works, and it's going to explain how the test works, how the program basically works, and then it's going to give you an opportunity to have a free phone consultation with me on exactly how we can take care of this, all right? Because this test and the program that I'm talking about is literally going to change your life, all right? It is going to save you years of time and thousands of dollars on people using, following ridiculous diets that they're not sure are right for them, and taking pounds and pounds of useless supplements that they don't know are right for them, okay? This will tell us beyond a shadow of a doubt exactly where your breakdowns are metabolically and exactly what we need to do to fix it, all right? If you want that, put test in the comments. I'm excited to help everybody out there. Thank you for commenting. Thank you for getting back in there. It's going to be great. And please like this and share this, because I know, listen, I've been doing this for a long time. I know that, we can, sometimes people think, oh, you have a low thyroid. It just means that you just have a weight problem. Man, it's so much more than that. It's so much more devastating to your health, to your life. I've seen it in just so many patients of how it impacts their life. It's awful. And so if you have a thyroid problem, you know somebody who does, then please like this and share this. At the very least, get CBD oil. I mean, even while we're waiting for tests to be done and all that, I tell everybody you should be taking CBD oil. It's super positive for your immune system. But if we want to get even deeper, if we want to know exactly how to reverse it and fix it and live your best life now, then definitely go ahead and put test in the comments, all right? If you want to be on my team, direct message me. If you want the CBD oil that I recommend, direct message me. Please like and follow and share this. Also, go over to my YouTube channel at Dr. Jim Holland. That would be awesome. Yes, thank you very much. Thank you, Kylie. That's awesome. So definitely do that. So that's it. That's what I got for tonight. So just like I tell my son every day before he goes to school, be your very best today. Hashtag never quit. And I believe that God wants the very, very best for you. And the day you believe that, it'll change your life forever. Have an awesome, awesome night.